All right. Hello, Mrs. Jones. My name is Rich Kitcho. I'm a student nurse at Purdue University Northwest. Today we're going to be putting in a Foley catheter because you're having some urine retention, so we're going to try to help you out with that. I'm going to perform some hand hygiene. All right. And while I'm doing that, can I please get your name and date of birth?
Mrs. Jones, June 29th, 1960.
Perfect. Let me just check that on your ID band. Perfect. All right. So I'm going to raise your bed. And as I raise your bed, I'm going to ask you real quick, are you allergic to any iodine or latex?
Yes, I'm allergic to iodine.
Okay, perfect. So we'll be sure to exclude that from the procedure. Okay. Close that real quick. And I am going to perform some perineal care before we put in the catheter.
Okay.
Get your legs up. I'm going to put down this bath blanket to make sure you're a little more modest and keep you warm. Okay. And I'm going to put down this chunk just in case we have some leaks.
Yeah, I just kind of went back and forth.
Okay.
Okay, I'll go back and forth. So that way, either way is fine.
I'm looking at my basin of clean water.
Yeah.
We'll perform some perineal care.
Not the,
Okay. And they're going to pat dry.
Alright, hi, Mr. Smith, my name's Amanda, I'm going to be your nurse today. We're going to be inserting your inhaling catheter
Right.
that the nurse has.
So I'm going to
Looks like you have a little
move
bit
my
of
gloves.
insertion, so that'll be able to help you out with that a little bit.
All right, now I'm going to put the catheter on the bed and prepare my sterile field.
Can you state your first and last name? And then, Mr. Smith, do you have any allergies to this area, such as to iodine or latex?
And I will perform hand hygiene as well before all
I'm
this.
just gonna get you all covered up with this bath blanket here.
Okay. Okay, so typically my struggles are being here, but I have a larger pair so it can fit me better. Typically, if that happens, I would get a new pair of sterile gloves.
So I'm gonna get your perineal area all washed off for you, okay? So I have the wash basin here, and I have the towel that I can soak your water with. So I'll leave it out there. I washing in circular motions down the shaft. And repositioning within each swipe.
Okay, move that out of the way. Okay. With this first drape.
And then I'm gonna pretend that this is now a rinse basin. I'm gonna do the exact same thing to rinse off the area.
This drape, I'm going to extend my sterile field. And I'm going to throw this drape in the garbage. We don't use it. Okay.
I'm going to draw the area, just gently patting. Dry it off nicely.
Alright, and just to confirm, you are allergic to iodine?
Yes, I am.
Alright, we don't use that for this procedure.
And then I'm going to begin setting up my sterile field.
There. Okay. So I would use the hydrogen peroxide to cover my cotton ball. And I would put the jelly right here.
Or putting some of my materials
I'm
into
going to carefully remove this. Okay. I would put this in my jelly lubricating 1 to 2 inches. Take my syringe. Okay, so now I'm going to use the hydrogen peroxide on the perineal area. Okay, normally this would go in a sharps container.
my first drape.
Alright, now I'm going to insert the catheter. It's going to go between 2 and 3 inches in. Before I insert it, I'm going to ask Mrs. Jones, please take some deep breaths. And I'm going to count you down from 3, alright?
Okay.
3, 2, 1.
Place this one over as well.
18. So at this point, we would see urine flow. I would go in a couple more inches after that just to make sure we're in. Okay, so I'm going to hold on to this. I'm going to inflate the balloon.
I'm just going to gently pull this back just slightly. And I'm going to use my additional drape as an additional sterile area to work with.
Okay. We'll clip this off. Normally this would also go in a sharps container. Okay, so now that that's in there, I'm going to grab the leg strap. Or first I'm going to see if it's in there, and it is, because there is some resistance. So now I will grab the leg strap.
I'm going to undo my lubricating jelly, squirt some of that into my tray here. I'm going to uncap my syringe and attach that to
So just like this.
lubricate the bottom 5 to 7 inches of my catheter.
Go like this.
And then taking my
Insert that
straw
through here. There we go.
on and move in a circular motion with the straw.
Okay, and making sure there is some like here. Now I'm going to take the bag, make sure to keep it below the bladder as I move it down here. I'm going to clip it to a movable part of the bed so that it does not constrict when the bed is moved up and down.
As I do this, and then I
Okay,
will also apply
so I'm going to
the
clean up
anesthetic towel that would be
the
needed
area.
before inserting
This will all go in the garbage normally.
my incision. So I'm going to
And typically I would remove the chunks as well, but for the sake of the video, I'm going to keep it because we do need it for removal. Okay, I'm going to do some glove removal.
I'm going to begin inserting. I'm just going to have him take a deep breath and then just
Okay, I would perform hand
might be a
hygiene.
little uncomfortable feeling.
Well, before I would obviously make sure the patient is comfortable. I would pull the gown down and pull the blanket back up. But for the sake of removal, I'm going to pretend I came back into the patient's room. I would ask them their name and date of birth again.
4 inches until I get to the wide.
I would put them in the correct position for removal, perform hand hygiene, and remove some gloves.
Once I reach that area, I'm going to hold on here and I'm going
Or put on some gloves, excuse me. Alright, so first thing I would do before removal,
Inflated.
I would put this chucks down here.
Discard it up into the sharps container. Just my balloons.
Around, I would take this
Pull back just a
cylinder
little bit
and I would empty the bag into here. I would see the amount, color, and odor. I can see it's a yellowish urine, say 500 milliliters, and there's no foul odor. So I would dispose of this in the proper container,
Catheter should be wet.
and then I would grab the urine bag. Being sure to keep it below the bladder, and then hopefully that wouldn't happen, but I would also remove it from the leg strap. Off to the side. I would get my empty syringe. Normally I'd have a new syringe, and I'd stick in here and let that flow up through gravity. Okay, and I would explain that to the patient that we're taking the catheter out because they are no longer retaining as much urine. I'll count them down before I remove it. Tell them to, I'll say, please take some deep breaths before I do, and we'll make this as quick and easy as possible.
Syringe into the port here, and then send that off to the lab to be tested. So then I'm all done with.
I'm just gonna make sure that all comes out.
The insertion of.
Okay. Now I'm gonna pull out, so I'm gonna count you down. Take some deep breaths, okay?
Okay.
3, 2, 1.
Doff my gloves and clean
Then
everything
here.
else up.
This should go in the proper
And then
waste
come back
container.
in to do,
there for
the
now.
removal, and I
Need to
would reintroduce myself.
Pull the
to
gown down, and I would offer the patient peritoneal care. This, and I was also supposed to offer the patient peritoneal care after inserting the catheter. But, would you like some peritoneal care right now?
No, I'm fine, thank you.
Okay.
A new pair of gloves.
Hold on. Okay. Guess I'm gonna put the feet down. They're in a comfortable position. I would also put this in a soiled linen container.
And then I'm gonna take a chucks pad, and this will be placed down on the ground. And then I'm gonna be inspecting my urine for the color.
Okay, Mrs. Jones, is there anything else I can do for you?
No, that's fine, thank you.
All right. And I also inform the patient that they should be able to avoid urine by themselves between 60 hours from now. Alright, that is down. I make sure the collar is in position. I'm going to take off my gloves and perform hand hygiene. And, Mrs. Jones, I hope you have a great day.
Thank you.